Hello everyone, I'm Dr. Vignesh. I'm an ENT and head and neck oncosurgeon. I also subspecialize in snoring and sleep apnea surgeries. Today I'm going to talk to you about a brief introduction into ear infections, what they entail, what are the symptoms, what the signs, how they affect our quality of life, and what are the management options. When it comes to ear infections, there are varied types of ear infections a patient can have. Patient can present with a ear discharge, which could be foul smelling. Patient can have decreased hearing. Patient can have tinnitus, which is ringing sensation in the ear when there is no external source of sound. Patient can also experience echoing inside the ear. Patient can also experience a blocked sensation which is not going away even after adequate medications. So these infections can be from your childhood, or you could have developed secondary to excessive trauma caused by your earbud usage. That's another thing. I strictly advise not to use earbuds for your cleaning because most of the patients end up damaging their ear canal skin, which is very sensitive, and end up having fungal infections or bacterial infections of the external auditory canal. So when it comes to ear infection, which affects your eardrum, patients end up having recurrent ear discharge whenever they have a nasal infection as well. And one of the causative factors for your ear infection is nasal infections. So whenever you develop a nasal infection and you tend to have a ear block, please do visit a ENT consultant so that your ear infections can be managed adequately, because inadequate treatment of your nasal and ear infections can cause a permanent rupture of your eardrum and can have permanent hearing loss as well. So what are the other symptoms apart from your ear discharge, decreased hearing, tinnitus, which is ringing sound in the ear? There are certain dangerous side of ear infection, wherein if the ear infection in a immunocompromised patients, these infections can spread along your skull base and spread to other areas where they can cause palsies of your face, palsies of your lower cranial nerves. So patients who are diabetic, patients who are immunocompromised, I strictly advise not to use earbuds because these can end up in skull base osteomyelitis. So when it comes to, a patient who comes to our clinic with these symptoms, what do we do? So as I mentioned earlier in my previous videos, all our ENT, ear, nose, throat, these structures are inside our cavities. So we need to examine them through our endoscopes. It's not painful. So we try to see how bad is the infection, what are the structures involved in your ear infection, what kind of medications you require. Most of the patients end up going to pharmacies, buying ear drops, and they don't know what the pharmacist is prescribing you. I've seen patients using wax dissolving drops for a bacterial infection, which will be of no use. And I've also seen patients using antibiotic ear drops for a fungal infections. So please don't self-medicate. Preferably come to a ENT specialist, get it checked what type of infection it is, so adequate and a specific medication can be started. So if a patient is suffering from a chronic ear discharge, that means patient is having most probably a hole in his eardrum, which predisposes him to recurrent ear infections. Also, every time he is going to have an infection, his hearing level can be affected further, because there are 3 tiny bones inside our ear, which with each infection can erode it. So progressively his hearing capabilities might get affected. His quality of life can be affected. His speech identification, speech discrimination, and at workplace can get affected. So what we do? So you are presented to us, we have treated. So what we also, once you're treated these infections adequately, you might have a dry ear, but with a perforation inside your eardrum. Then we will ask you to get a hearing test to assess your hearing capabilities. And based on those results, you might require a procedure, if it is not healing on its own, to patch the hole in your eardrum. And if the infection has spread to your bones, then along with these ear perforation repair surgeries, you might require another procedure in the same sitting to remove the infected bone part. Sounds all scary, but with the advent of endoscopes and microscopes, now these have become minimally invasive surgeries where certain surgeries don't even leave a scar outside. We do these nowadays with these endoscopic advanced techniques wherein you may not even have a scar outside the ear, and so certain surgeries will leave you a scar which gets hidden behind the ear, so none of it is visible. And most of these surgeries have now progressed to day case surgeries thanks to all the advancements we have nowadays. So these surgeries are done on most of these surgeries on a basis of day care, where you get operated in the morning and you're discharged by the evening or next day. So what are the precautions you need to take to avoid ear infections? One, first and foremost, as I've repeatedly been telling in the video, avoid use of earbuds because you don't know how to use them, and usually we don't require to use earbuds to clean our wax, or even if there's infection, we don't need to use it self because most of the patients are unaware what is the depth of their eardrum they have. I have seen quite a few times where the patients are presented to me with rupturing their eardrum while in the process of cleaning their ears. So the entire point of cleaning your ears, you're ending up with a eardrum perforation. So I strictly advise you not to use earbuds. So that's the first and foremost precautions to avoid ear infections. Second, please, when you're having an ear infection, or if you have a history of ear infection, preferably while having a bath, you can use a cotton plug to prevent water seeping into your ear, which can cause fungal infections during winter time because of the retained moisture inside the ear canal. And every time you have a nasal infections, it's very important that you get treated adequately because nasal infections again can spread to your ear via the eustachian tube. So this is the third precautions you can take. Any other precautions apart from these? Generally no, but when you follow these three things, most of the ear infections can be avoided. But there are certain infections during childhood which can develop on its own. There's something known as atticoantral disease, which is not an infection, it's basically skin in the wrong place. So when these kind of conditions develop, it is not an infection, but the skin kind of a condition in the wrong place can keep growing and predisposes to infections happening in the bone. For these conditions, you need not to do self-medicate because it's not going to go with your eardrops. And another most common complaint which I see is tinnitus, which is ringing sensation inside the ear. So when we investigate these patients, many of these patients might or may not have an ear infection. If they don't have an ear infection, they have a tinnitus, that is ringing sound in the ear, it can be due to multiple causes from your outer ear, middle ear and inner ear. So we first rule out what could be the cause. Sometimes even with normal hearing, they can have tinnitus. So again, as I informed earlier, there could be hundreds of causes for these. And to explain all this in a video is slightly difficult, but first and foremost, it's always important that you consult a right specialist to rule out these conditions and to get treated specifically for that condition than self-medicate and increases the chances of ear damage. Thank you.